Flex forward.
Agáchate para adelante lo más que
Tell
puedas.
me what's going on with your pain down the leg.
¿Qué
as you do this.
sientes con el dolor debajo de
Can
la
you do 10
pierna?
of those? Come back up and repeat.
So, mira lo que vas a hacer.
Increased?
Vas a hacerlo 10 veces, para abajo y para arriba, y vas a le vas a decir ahí si el dolor se puso más
Do like
fuerte o
5 of
te quitó.
Que yo tengo un problema y yo no me canso los pies,
Oh, no tienes que alcanzar los pies, lo que tú puedas.
ni me puedo agachar.
Go ahead.
So, vas a hacerlo 10 veces.
And back up. And what I'm looking at is where her motion's coming from. So there's no activity through here at all. So everything's hinging from here. We like to see in a normal spine, we like to see segmentation, flexion throughout. Because if you're getting 100% through here, 100% of the force is going here. So we need to do the cat camels, the merengue, right, the salsa, however you do, to get this going. You got to get these moving. So what's happening with the leg?
¿Qué está pasando con el dolor?
On the right? I thought you were left.
¿Te duele?
Sí, me da ciática.
First it was left, then
ahí.
it was right, she said.
Y ahí.
All right.
So all
Now-
the pain, se está bajando toda la pierna, all the pain is going down her leg and on
Okay.
her back.
Face this way for me.
Ahora, dóblate del otro lado.
No, you're
Todo
not face.
completamente. Ajá.
Can you go backwards?
Ahora,
That's all.
vas a ir para atrás, sin doblar la rodilla.
10 times. Back.
10 veces. Atrás. Ajá.
And again. And again. This is the, talked about this, right? In the Kenzie, I'm going backwards to help push, hopefully, maybe see. Talk to me about your pain in the right leg. Better, same, worse?
El dolor en la pierna. Mejor, peor.
Mejor.
Ah, see?
Better.
Easy. So we know she's disc, right? Pretty easy. I think she's disc on the right and SI joint on the left. Now, we'll know about the SI joint, that's good enough. We'll know about the SI joint if you stand on one leg.
So, whichever one.
Doesn't matter.
Te va a parar en una pierna solamente.
So I have, when I have a patient stand on one leg, they're going to stand on the one that's better first. You're always going to want to go to the one you're dominant. So she knows she's dominant on that side, which makes sense. And then, can you bring your left knee to your chest while you do that?
Ahora puedes subir la otra pierna así.
And then I'll look at the SI joint. I want to see, remember this is the ilium, this is the sacrum. I want to see if the ilium actually moves and rotates. So do that again on the right.
Hazlo otra vez.
Pretty good. Do it on the left.
Ahora hazlo en el otro lado.
Nah. It's hard to see, but she compensated. She got her leg up by doing this. Do this again.
Hazlo otra vez.
See, it's like this. Do this on the right side.
Ahora del otro lado.
See, that moves. So it's stuck. I was right. Left SI, right disc. Okay, boca arriba. So then that's the movement of bridge assessment. Now I'm going to look at static. Now everything changes because now the spine, just like that spine is laying on the table like that. When you stand up, everything changes. When you lay down, everything changes. I'm going to correlate the two to see if what I found. So if I'm in my head, I'm thinking, okay, we know that the left is SI joint, so their left leg's probably shorter. I don't know. We'll see. I've been wrong before. Bend both knees.
Dobla las dos rodillas.
Lift your butt up.
Levanta la
Levanta tu
cadera
culo.
para arriba.
See, and back down. And down.
Y bájalo.
Glúteo.
Glúteo, levanta. Relájate, relájate. Yeah, so this leg's shorter, which is what I thought. So I'm going to go and check this hip flexor out. So when you have the issue on the SI joint, we know it's hip flexor. We know that the disc is over there. It's probably more just the QL or the muscles in the back. Just relax. Any stomach
Relax.
issues I should be aware of?
¿Problemas con el estómago? ¿Qué debe de saber?
Yo tengo, sí,
¿Qué tiene?
gastritis.
Gastritis.
Does she have any scars over here?
¿Tienes alguna cirugía en esa parte?
So when I look at the hip flexor, I'm looking at the ilium, the front part of the ilium. Can you show them that?
Sure.
And that, just put up the hip flexor that runs from the elbow, 2, 3,
This
4,
way?
the other way. So I'm right here. I'm actually getting into the pelvis this way.
So eso es lo que está haciendo con
And
ella.
then
Se
the
está
hip is
metiendo
down
ahí.
here. Try to relax. What are you feeling?
¿Qué sientes?
¿Qué siente?
¿Qué tú sientes?
¿Qué tú sientes?
Mejor,
¿Mejor?
sí.
What?
It feels a little better.
It should take that long to release this hip flexor. So what I'll do is I'll get it. You feel that?
¿Siente eso?
And
Sí,
then I can
ahí
release.
adentro.
Yeah, she feels it, yeah.
And then I'm going to release it. Now I'm going to make it longer because I know it's shorter on this side. The leg was shorter. Now sometimes you have a structural shorter leg, which means the leg is actually shorter. It's pretty rare. Then you have a functional leg, which means the compensation for all your issues have occurred. So now there's a sort of the sacrum is turned. Can you turn that sacrum? The sacrum iliac joint in the back. So for her, right now, I know it's like this. See this? This goes back. When this goes back, it makes the leg look shorter. It's not actually shorter. I'm going to make it equal in a minute.
So, porque la cadera está apretada, la pierna de ella está, una está más corta que la otra, pero no porque está así.
Any other
porque
injury
está
that
bien
should be aware
apretado.
of? Does she have anything else going on? Ankles or
¿Tienes algún
knees?
problema?
Relájate. No.
¿Tienes algún problema con los pies, con los tobillos?
La asiática a mí me
I wish you
da.
had some.
Solamente eso.
So
Nunca
it's
se
a
le
lot
los
better.
pies, nada.
Ese pie
Now,
siempre
it's going to go
está
back if I don't give her
durmiendo,
exercises.
durmiendo.
And that's why I need to give her
Ese pie.
exercise.
No problem with her ankles.
De ahí para allá eso yo no sentía nada.
So
Yo
let's
tenía
lay
mis-
on your side,
Te vas a acostar
Después de
de lado.
del lado izquierdo, and then we'll go, come back towards me. There you go. We're going to bring this leg up. Now, we talked about the facet joints and how you had a good question about that, the compensation, because it closes it down. So I'm going to put her in a position that I'm going to put it here. I'm going to put this leg forward. You can appreciate how that, see that space opens up? It opens up. So I'm going to say she might be a disc, but we know extension helps, but how much percentage it versus a facet? We're not sure. The proof is in the pudding. If I get her better, then I know it's 1% versus the other. I know she had surgery, so we're going to need to, how long ago? 2003?
5.
2005? It's a little while, so 10 years, but we could, it's never too late to break up scar tissue. That's why I always ask if someone has scars, the body will use the scar as an anchor and pull from it if it's never released. It's not ever too late to release a scar. So what I would do is use like vitamin E, wheat germ oil, my hands, heat, ice, those sort of things to reduce the layers of the scar that creates binding, and the body will use it as an anchor, like a boat. Use as an anchor to kind of hunker down. ¿Está bien?
Sí.
Is it going down the leg at all?
¿Te está bajando el dolor hacia la pierna?
That's why I want to see if I can reproduce it. I don't want to reproduce it.
¿Te está bajando el dolor? ¿Sí?
No.
¿No?
Okay.
No.
Now, you usually have a test, retest. If my bending forward isn't a good test, I should have had her do something else, but she'll know if she's better just by walking around probably. Usually have somebody squat or do something that hurts them typically. And then I'll retest it, that way I know if I'm wasting my time or not. Bring this leg up. Now the sciatic nerve, this is a good, runs right through here. It comes down, it actually branches here and then branches again. So it has a couple different branches and it innervates the hamstrings, which is important too. So if the bike break is here, sometimes the hamstrings will guard and get tight, and then you have another pinch nerve here. Sometimes the hamstrings will try to work for the abs. If your abs aren't working, the hamstrings will go tight. Abs. You got abs? No. Come on now.
Wants them.
Oh.
You can get them.
I could.
Yeah, you just gotta work.
You gotta eat right, number one. 80% is
That
eating.
drives me crazy. He looks at himself in the mirror.
Don't rush into
Okay,
it, honey.
Camina.
I tell him,
You'll
wait
get-
your time.
You'll get them eventually, believe me.
That's
I'm
what I
thinking
tell
about
him.
education, if you're ever in a position in your back, and we
Una
never,
cosa que a mí me está pasando ahora
Feel like
es
as a kid, okay, first.
que me da una picazón horrible ahí y aquí, que hasta
just
medicamento
try
estoy
to
bebiendo.
walk.
Y aquí, en esa parte ahí. Y yo, no, así que me pica. Y después que si me rasco me duele.
Just have her
Y la
walk.
doctora me
She
dijo a mí
stands
que eso era el nervio pinchado.
Camina.
Eso yo lo voy a preguntar ahí. Camina.
Yeah, 'cause
Camina
what-
para allá y para
basically,
atrás.
I'm also resetting your nervous system when I do this, so the brain knows that I just manipulated something. If I had her then just sit down, everything's gonna go back. So what I do is have them walk. Walking basically initiates a reflex in the spinal cord called common pattern central generators that creates a nice relaxing, hopefully, for the muscles. So the muscles can start to relax. She just walks. So if you're ever on your back, never just come straight up. Okay, you can train for that eventually if you're a wrestler or if you have somebody on top of you and you want to get them off. We can train you to do that, but typically you never want to go from this position up because the hip flexor lies in here, right? So with the hip flexor's in here, it contracts, and once again it pinches the nerve. You want to roll first, like she did. Get the legs off and then come up. Very important. Every day in the morning, the first thing you do not come straight up.
So the first thing I do, I stretch in the bed first,
That's even better.
and then I go
Breathing
on my
is important.
side.
So the other thing I haven't touched on yet is diaphragm
¿Entienden cómo
breathing.
no levantarse?
I'm going to do that with somebody in a minute.
Que eso es lo que está explicando, que no se levanten, porque la mucha gente cuando ellos se levantan, hacen así.
Oh,
No, no.
it pinches the discs. It
Eso
makes it
pincha los
abdomen.
nervios, pincha los
No good.
discos. So, él dice, de lado, y te levantas así.
And then number 2 thing I teach my back patients is how to bend and lift. And if we don't know how to squat,
I'm sorry.
how do you feel?
She said she's okay.
All right, I'm not going to test it. The flexion's not a good test because that's just going to push the disc back. So if anything, what I would do is I would use my taping mechanisms. I could tape the back to put you into extension and keep you there, to remind you when you go right now to go do something. So watch this. If I go and bend to pick up something, and I initiate it through my back, that's going to start the disc. But if I create a hip hinge, and this is what Jody and Michael and Andrew do all day long, is we teach you how to hip hinge like this. My back is not moved. This is straight. If I'm going to do this first, and then pick up something, all my glutes and my hamstrings are going to be the power source. Versus most of us will just do this, see? And once again, we talk about the disc. And then God forbid you pick something up and try to pull it up. That's going to cause the disc. So the second thing after I will teach you is how to hip hinge and how to squat. Maybe not today, but for somebody we can teach you how to do that. All right. And number 3 is hydration and nutrition. Those are the 3 things, staples for backs. If you're dehydrated, those discs will become lessened.
You're talking about dehydration,
Yes.
drinking water.
Yes. Well, not just drinking water. You can drink water and just pee it out, and all your electrolytes go out, and become just as dehydrated if you didn't drink water. Sometimes you're actually better off not drinking water, because at least you have the fluid in your body. If you are peeing clear all the time, your electrolytes are off. A good way to contain or to maintain your water in your body is to eat celery. It's very good natural sodium. Take celery, put some peanut butter on it, a couple raisins on it. It's good. That's a good thing for you to keep. There's also magnesium. Ever heard of magnesium? You can find it in leafy green vegetables. If you want to get into detail, it's the sodium, potassium, calcium pump. That's the main thing in your body to keep your cells healthy. If you see really good skin in somebody that's in their 70s, I guarantee you they've been eating well their whole life. I've never seen a 7-year-old that eats like crap and have good skin. That's because of their cells in your body. It's important to have magnesium.
El potasio dice que...
Magnesium.
Oh, magnesium.
Magnesium is the controller of the potassium and the calcium, those sort of things. So you can be lacking calcium and take all the calcium in the world, it's just going to go right through you. Because the magnesium is the catalyst. It's what actually puts the calcium into your body. It's called an uptake. So you can eat all the leafy green vegetables in the world, you may not still get enough magnesium. There's something called natural calm that I swear by. You might want to write this down, because if you don't need magnesium, your body will just clear it. You might want to talk to your doctor if you're on certain medications as a disclaimer. But natural calm is a wonderful, wonderful thing to take at night before you go to bed for many, many reasons. Yes, it's a beautiful thing. Read the instructions on the label, because if you take too much, you will poop too much. It's a tablespoon, I believe, a teaspoon, I believe, with warm water. It fizzes and creates a nice fizz. You add a little more water to it, and it has different flavors. It's the last thing at night you take before you go to sleep, versus the meat and the protein in the beginning. The reason why is for reasons in your brain and the cells. It puts you into a different sleep pattern. So now you're sleeping better, you're on a good mattress, and if you get into that REM sleep, your body will actually heal. And if I can put your body into an environment to heal, you will get a lot better. So that's the other thing I use.
Let me ask you something. Do you think those injections that they do, because I had 2 processes. The first process that I had, they asked me how they called me after the injection surgery, and they asked me how I was feeling. I said, I'm feeling good. Okay, we have to do the second one. I said, no, but I'm feeling good. I don't want to do that right away. They wanted me, but I feel that after that injection, my body really got, I've always eaten healthy. My body, I had a car accident, but my body wasn't that bad until after I had that injection, the second one.
What do they have?
It collapsed my whole body.
But what do they have inside the injection? Did you use a steroid?
That's,
Corticosteroid?
well, the insurance of my car insurance, they send me to different orthopedic, you know, when you're in a car accident, they send you to different. And I don't know how many orthopedic, I think it was 3 orthopedic I went to of the insurance. And they asked me, because every time, she knows because I've been here, but Lee was the only person that really took care of me.
Right.
Every time I turned or anything, or they would touch me, I would then collapse, you know, my body. And then they asked me if anybody injected and took liquid out of my body. I said, well, I don't know. I know I had injected, you know, this is like surgery. I mean, they put you down, they tie your arms back,
Oh, no,
and
I
they
died.
inject
Oh,
you.
no.
And I was scared,
Yeah.
you know, that's scary, but
Basically what happened to your body is you went into a fight or flight mode. Your sympathetic nervous system went on overload. Okay, so this is
my
another...
my brain.
Yeah,
Now they
that's-
say that they say that my brain, it's disability sent me to a lot of x-rays,
Okay.
and it's my brain, and I get like balls all over the night, balls, like inflamed. They say some of my
Yeah.
cells of nervous is worning out.
To keep it simple, you're probably not in the right sleep cycle, which is probably why it prompted you to ask that question, right? So and our nervous system is designed for survival, so it does anything it can to survive. So if you're in the woods and an animal scares you, you're going to go into sympathetic nervous system, fight or flight. You're going to fight that animal or you're going to retreat, okay? Now, parasympathetic nervous system is what we do when we breathe correctly, we meditate, we have stressors in our life that we can, you know, contain. We're not going to get rid of them because stress is actually a good thing. And I can get into this a little bit if you guys want to. Our body has one container for stress. You can have physical stress, which is what we kind of went through today. You can have emotional stress, which is how you cope and how you deal with things. Another physical stress is what we talked about, the nutrition. You can have religious stress or spiritual stress, that you're not comfortable with certain things, and all of that gets put into one container. Now, if you wanted to separate those containers out, which we're talking about maybe 4 containers, your physical stress may be 90% full, your emotional stress may be only 10% full, but that 10% still gets put into that one container. So you have to manage all of your stressors in life to reduce. Now what happens when that container overflows? Inflammation in your body. Or sympathetic nervous system issues, lack of sleep, lack of ability to concentrate. Meditation is key, breathing is key, reducing your stress is key for reducing inflammation. That's all going into one thing. I'm branching off on a whole other seminar that I used to do, a 4-hour seminar just for that. It talks about that.
¿Qué dice que hay que hacer para uno evitar el estrés?
Él dice, what was the meditation to reduce stress?
Yeah, I would say number 1 is breathing.
Respirando es uno de ellos.
So respirate, easy to do, write this down. You can look up diaphragmatic breathing and how to do that. If you're not, like I just did it right there, I'm out of breath a little bit. If I'm not breathing from my diaphragm, your oxygen won't exchange, all right? Your energy and your chi won't be where it's supposed to be in your body. It'll be placed in your upper traps or your back or different areas of your body and your organs. So if you get up in the morning, before you get up, maybe she stretches, which is a beautiful thing because that's reducing your physical stress. But I would say take it one step before that and take the moment to put a bolster underneath your knees or just get in a position where you can breathe. Put one hand on your stomach and one hand on your chest. And initially, where do you initiate that breath from? That was all from up here. Now, if I can initiate it through my stomach, breathe in through your nose, out through your mouth, through pursed lips, that creates an exchange of oxygen, that creates energy that's positive, and it will reduce your stress for the rest of the day.
You know, we watched his daughters how to do that years ago.
It actually also allows you to absorb your nutrients better and to digest better. And same thing, like I said, you could eat the best foods in the world. Your body doesn't want it, and the enzymes aren't there to break it down, or the probiotics and the kefir and yogurts that you should eat. You won't get that nutrients. It'll just void. So breathing in the morning, do your stretching, Don't come straight up like that. Don't brush your teeth right away. Get your meat and your protein done.
I gotta get going with the kids. I can't wait.
Have beef jerky next to your bed. Yeah, that's what I do with my kids. Yeah, beef jerky. Eat that beef jerky first thing in the morning. That creates the enzymes in your mouth, and it breaks down the foods in your stomach. Trust me. And then go have your egg and your avocado. Then brush your teeth, wait 2 hours, and then you can have your carbs and your other stuff that you like. Coffee in there somewhere too, of course. Coffee's good for you, by the way. Any questions about stress or reduction of those sort of things?
¿Tienes preguntas del estrés?
Because inflammation in your body is inflammation in your body, and if you can reduce the inflammation in your body, everything will fall into place.
Después de la respiración, ¿qué otra cosa dice?
Bueno, él dice que cuando uno se levanta por la mañana, trate de respirar, pon algo abajo de las rodillas, respira through your stomach, right?
You want to breathe in through your nose so that your stomach raises first, and then your chest raises. You want to build it from the bottom up.
So que respira por la nariz, que tu estómago vaya creciendo y después el pecho.
Sí, eso lo entendí.
Sí,
¿Y el
eso.
siguiente?
Y el siguiente, como te enseñé, no pararse. No te pares así. Acuéstate de lado y te paras así. Ajá. Y dice que la proteína, no te cepille, la primera cosa que tú comes es proteína.
Okay.
And you're sitting at your desk. That's the other thing we talk about is ergonomics and sitting at desks. They have these little egg timers, or on your computer they have applications that an alarm can go off every 20 minutes. Get up every 15, 20 minutes. If you have an issue, get up every 5 or 10 minutes. They have standing desk stations that you can order online. Amazon has them. Those are wonderful things. Trying to not sit like that. Trying to get yourself a roll. We actually sell those rolls here. We can talk about what we sell up there too, to have that. Because you, once again, if I'm sitting, that's flexion, and we're in flexion all day. But if we put a roll, especially in your car, if you can, even if you rig up towels and duct tape them, and then put a bungee cord around the back, you got your, that's easy, it's all in the garage, right? Boom, put it there. Now you're an extension. The other part about your car too, while I'm thinking about the newer cars especially have this lever. So you have the one that does this, make sure you're not too far back. You have the one that does forward and back, make sure you're not too far forward so you're doing this, because that's sciatic. You want to be closer. The third one is that this is a cool tilt thing. You don't want to be down like this, because that's one thing I'm putting pressure. You don't want to be too far up like that, because that creates pressure. There's a sweet spot for you in there. Make sure you use that adjustment. So adjust your cars appropriately, adjust your workstations appropriately. Make sure you breathe during the day, in the morning for sure, and we have the nutrition down. Any other questions?
I got that office chair it says for the back.
Right.
And then I bought the piece for Christmas. I got it. My husband got it for me. Is that thing that you put on the chair?
Right.
Oh, it's like
And
a
then
mesh?
it has these, and then I put it
Seen it,
with
yeah.
the button.
Oh,
It makes
that's
me
cool.
feel better, and it massages my back. It makes me feel a little better. But it's only, momentarily.
Well, I'm thinking of it too. You talked about massaging and modalities and external things that you can use. Make sure, when in doubt, use ice, don't use heat. Because we talked about inflammation, most of us are stressed and we already have inflammation. Heat brings more inflammation. Why do we get red when we put heat and ice? That's weird, right? Two different things create the same result. You can make yourself red? Hold your breath? Don't do that here, I'm gonna pass out.
He likes to.
I don't want to use my CPR. My son does that too, and he's 9. We gotta talk. So ice is different because it creates constriction first, which releases, think about a sponge. You're getting rid of the stuff first. If you have a sponge that's already full and you're going to add more, it just creates more. That's pressure. So all of our body has joints. Let's just look at the plastic Tupperware. The ideal sort of pressure, if you will, on the inside and outside is X. When you already have inflammation in your body, you're not eating right, and you're stressed, you're not sleeping, there's pressure already. You add heat to that, that's going to pressure more. You add the barometer to that, when the weather changes, you're talking about atmospheric pressure coming down on that. That's pushing what's already in there out. That's why we have issues with weather and we have those sort of things because of that. So if you can create ice rather than heat, that's awesome. There's nothing we can do about the weather per se, but I guarantee you'll start to feel better during bad weather when you have less inflammation in there. If you have the tendency to like humid weather versus dry weather, that's sort of a whole other acupuncture thing, that there may be too much wind in your body or not enough wind or metals in your body. That's a whole other topic. We're covering a lot. Any other questions?
this.
How are we doing time?
Oh, we're fine. It's 12 time.
Okay. We covered everything there. Anything that I didn't cover, I want to talk a little bit about organs and surgeries, and since you're all females here, menstrual cycles and menopause a little bit too. Just, once again, that feeds into everything. Those sort of issues that you have organ-wise will help a lot when you start to implement these things that I'm telling you to do to anti-inflammation, reducing inflammation. That's all comes together with that. But I wouldn't use ice for here, though. You should use heat for here for you guys. You know, it feels better. And then hydration we talked about, nutrition, sleeping. Anything else we need to cover? If you want to hang around a little bit and let me put my hands on you, we can do that. We can. Right now we have like a 2-week waiting period for evaluations, but since you guys came here today, I can kind of figure out my schedule and get you in. If you wanted to give Plaza your insurance to get that going, we can do that. Whatever I can do to help you.
But do we need a prescription?
No, direct access allows me to not have one, and I can do my evaluation.
Medicare, I'm getting
With
April,
Medicare?
in April.
With Medicare, you do need a prescription, but he can still evaluate you. You would
Yeah.
need to get the prescription within 2 weeks of
Yeah,
the
it's within
evaluation.
about
Because
2
they
weeks,
gave
yeah.
me a prescription, but they sent me to some place in 40, I didn't know.
No, you.
Oh, you can go wherever you
Because
want.
I
Yeah, you
told them
have-
that they gave me the
No, yeah.
prescription.
That's
No, you
actually
can go where-
illegal
with that
to
I
make
can
them
come
tell
in.
you to go anywhere.
Yeah.
Technically, they have to give you 3 places or a list. So,
I told her that I wanted to come back with the same.
yeah, you shouldn't refer, like when I refer out, I always give 3 names of people so that I'm not, you know, I mean, it's one hand's not washing the other. So you always have to, you have the freedom and the right to go wherever you want.
So with that prescription she
You
gave me,
can
I
go
Oh, it's
told
good
her-
for anything. Yeah, it's good for any
As long as it's a
therapist.
prescription that says physical
It was
therapy,
last month.
it's fine.
No, just call and get a new one, just so it's
Yeah.
up to date.
You always want an up-to-date one. Yeah, always up to date, yeah. But with Medicare, you can still come and get evaluated. You would just need to get the prescription within 2 weeks of the evaluation. From any doctor, it could be orthopedic, wherever he thinks you should go see your primary.
Well, you know, they had sent me a letter telling me that, to call that number, that they will pay, Social Security will pay for my rehabilitation so I can get back, on the track to work a little.
And while I'm thinking of
At
it
least a
too,
little bit.
you may not have had, you may have neighbors or friends or family members that have back pain as well. Keep them in mind. You know, I've had back pain in the past, and I have 3 kids and a dog, and it just affects your family so greatly. So there might be somebody that you're thinking of too that could come in. That would be appreciated. Obviously, we're a business; we like to get busier. So think of them as well. And then if the insurance doesn't jive, I know we talked about one person where there's a $50 copay. We can at least give you the free consultation to come in and talk about possible payment plans. We'll work with you. You know, we're in the community. We're here for a service for the community, so we can do that.
You know, I don't understand why, these people, I mean, insurances, so I don't know who's in charge of this. They make you go to pain management. I never went because I feel if you're not gonna give me something that's gonna take the pain or the discomfort away,
Yeah.
I don't wanna be sleeping because I don't need to be sleeping.
They're not looking for the root causes, and that's what I do.
No, because usually what they give is Percocet. Percocet
Yeah.
is
Those
addictive and
are-
gets you depressed.
Yeah, those are.
And I don't need that.
Yeah.
It goes back to the.
Then when they get you addicted, because I see a lot of people when they come to my job, I work in an emergency room, well, they get you addicted, now they don't wanna pay for the medication because it got you addicted.
Well, medication is $3,000.
Those are all
Pain management,
So
$3,000 for medication.
our
And every
government.
time somebody's gonna inject my back, oh
Our-
no.
Unfortunately, our government and the way that
I'm a
health
chicken.
is set up is that it's a business. They like people being sick. If every doctor was like me, I'd run them out of business. All right, so I'm avoiding surgeries. I'm eliminating drugs.
When I saw
Think
the
about how
body
it's all
compression
structured. They
thing,
don't
I
want
said,
you to
oh
get better.
wow,
If the
I'm
system's
going
set up for you
there.
not to get better, unfortunately. If the system's set up for you to get a little better and then get worse, everything, our food, our healthcare, it's a little upsetting. I mean, we have a
Yeah,
great country, but yet there's other things that we don't do, and that's why
Well,
the
it's good and
Europeans
bad
don't.
in everything.
Right.
And everywhere, you
Yeah,
just
yeah,
So,
have
everywhere.
to.
but there's a lot of good here, you have to find it, you know, and like I found my friend Ken, who's a healer, and he's healing somebody on Tuesday, my babysitter was in the hospital. He healed my wife, he healed me. So you have to find, people find me, I'm the healer, so you have to find your right people and keep them around and and then refer people to them like I do.
We get a lot of patients, for example, I had this one patient the other day, she had back problems for a really long time. She saw him for one visit, she was so happy with just that one visit. She went to sleep, the next time she came to the visit, she was, I slept all night.
That's not always the case, don't put much pressure on it.
Yeah, I'm not putting, it's not always the case, but 80% of the
lot.
time, a lot of the patients leave very happy, and they continue coming back. Like he said, if you're dedicated to physical therapy, and you come in the times you're supposed to, and you do your exercises correctly, he'll be dedicated to you.
Right.
Yeah, that's all it is. If you come and fool around, a lot of patients just expect him to just, they want to rub down, they don't want to get exercise, they don't want to do exercise, they don't understand that's all.
Yeah, because I see a lot of people that they're disabled with herniated disc, and I say to myself, how come I'm still working? I mean, I don't want to be disabled. I mean,
A lot of people use it as a crutch, unfortunately, that's an emotional issue, and I have many times where I refer to psychologists, and people become married to their pain. They're so used to it, they get married to it, and they don't want to detach from it. I have a lot of patients that come in and tell me they're in 8 out of 10 pain, but they're smiling, and they're expressive, and they're happy while they're telling me. That's an issue, and I talk to them and I say, listen, you probably need to talk to somebody about that. And there's a lot of people out there, but then there's a lot of people that use it for disability and all sorts of things.
I feel that the exercise works when you're having these issues with the back, and if you don't practice them every day.
Yeah, that's the other thing too, you mentioned exercise. So when you talk about your treadmill, you talk about your cardio, when you talk about walking, the endorphins and enkephalins, you know what those are. So going back to when you have inflammation in your body, you stop producing these important endorphins and enkephalins for your hormones. Getting out there and doing exercise and getting your heart rate up is a huge factor in back, because the spine is so related to the brain. And there's a lot of studies out there that say, as Dr. Sarno says, a lot of 80% of people with back issues can be cured from emotions and those sort of things. There is some to that. But think about how you feel when you go on vacation and you're swimming and you're eating right and all the good fruits. That's all part of it, because you're getting your heart rate going and you're creating endorphins and enkephalins to block some of those pains. And when we alter the pain, a lot of PT places will put electrical stim on you. That just alters it. Electrical stim and ultrasound have no clinical correlation to actual healing. All the research doesn't show that. Unfortunately, the way the system's set up, they want to see 6 patients an hour. If I had to see 6 an hour, I'd be altering everybody's pain, because I just don't have enough time to manage it.
You're talking about that ultrasound thing and they put that it's like an electricity.
Yeah, there's electrical and then there's ultrasound. Ultrasound, you don't feel anything, it's sound waves that come out. I use that on 4% of my patients, only for a few visits. Electrical stim I'll use to help block the pain if someone's in a lot of pain. Some people like it, so I do it. Heat and ice is also one of those things that alters pain. Ice massage actually can get deep enough and cold enough to pump out some of those things. Contrast baths, ice and heat, those are actually treatments. So we don't like to alter pain. I don't want to waste your time, my time. We want to get to the root cause and want to handle your pain. And that's what we do here.
Yo, por ejemplo, tengo años que me mandan a terapia y eso no me ayuda a mí nada, porque la maquinita esa que me ponen así, eso es todo, y las toallas calientes.
Sí, esos son...
Y yo sigo igual.
Eso, por eso no le gusta eso es lo que estaba explicando. Esa cosa, esa máquina, eso no, él dice que eso no, clínico, eso no ayuda con nada.
No,
eso,
no.
Él le pone eso a la gente si tienen mucho dolor, él lo trata y después le pone eso con algo caliente o frío.
Sí.
Pero dice él que eso no trabaja. El ultrasonido y el STEM, eso no trabaja. Eso lo pone a la gente porque a mucha gente, a algunas le gustan, no hay problema. Alguna gente le dicen, a mí me gusta eso con una cosa caliente, eso lo pone para que si ellos lo quieren.
No.
Pero eso es lo que no le gusta, eso es lo bueno de aquí. Nosotros somos bien manual. Todo es manual. Tú vienes aquí, haces tu ejercicio, uno de los ayudantes están ahí contigo todo el tiempo, ellos no te dejan en una bicicleta y dicen, ok, vas hasta ahí.
And then certain massages the
Tú
same
sabes,
way.
ellos trabajan contigo, después que tú terminas, él te trata manual, está contigo mucho tiempo, te pregunta, ¿todavía tienes el dolor? Él trata de quitarte el dolor. Eso es lo que nosotros tratamos de hacer aquí, porque es que en muchos lugares, como es con compañías tan grandes que quieren tanta gente,
Sí.
tú sabes, ven 6 gente a la hora, nosotros vemos 2 o 3 a la hora.
And then there's certain massages that do the same thing. If I'm just going to sit here and rub you, I'm not actually doing anything.
Sí, y los masajes
You
también.
gotta get in there and
Sí,
feel the
si ellos te van a
tissues.
sobar así un poquitico, eso no va a hacer nada.
A lot of therapists give our profession a really bad
Let me ask you
name.
something, chiropractor, do you think the chiropractor, I mean, going for 6 months? And
If someone came to me for 6 months,
and then
I'm
you
sorry, if
get
someone
worse.
came to me for 6 visits and were
No
better,
months.
oh, that's what I'm saying, 6 visits, no. Chiropractic is a profession that's been founded a lot deeper and longer than ours, but it was founded on a business model. The first chiropractors found a way to create good, but you can't blame them, they want to feed their family too, but the models were created so that it was more maintenance, all right, and that's part of their thing. They're saying, hey, I'll crack you, it releases endorphins and enkephalins in the spine, it blocks your pain, and then it comes back because it's mechanical in nature. So when I looked at somebody move squatting versus on the table, I guarantee you the chiropractor wasn't, most of them, not all of them, weren't doing the functional part and the movement part. Well, I'm sorry, we move around. I don't sit in a table all day long. So if I'm treating you just on the table, and then you go move, it's gonna come back. I'm not giving chiropractors a bad name, there's a lot of good chiropractors out there that do both what I do and they do. And
Oh, I
they're very
imagine,
good.
yes.
But the typical, 10 in an hour, crack, boom, boom, E-stem, see you later. There's a time and place for that. I sent my own colleague out, our own employee out for a chiropractor because I knew he needed it, and it helped him. But then he came back for me for the follow-up, and now it's gone. But he needed those 2-3 visits with the chiropractor in order, and I sent him to Dr. Hernandez down the street. He's wonderful, and he sends to me, and we have that relationship. So the good chiropractors I have good relationships with because they don't just do that model. They don't just do that for 6 months. That's actually unethical and illegal.
I think it was too much, and that's when I
Yeah,
wanted to
it's
go
illegal. It's unethical.
with Tawik. But I think that it was like she said, they put me down with the machine and the heat, and then put me down in another, and then put your leg up, but it was 2 times, and then the 3rd time when she wanted to hit my back again, I said, no, that's it,
Yeah.
because I'm getting worse. She just, I don't know, I was laying down, and she just like gave me a karate thing, boom, ah, and I went like that. 2 times she did it, and the 3rd time I said, no more, I'm hurting too much. And then it kept getting worse and worse.
Well, unfortunately, like when you look at a carpenter and different professions, how many tools they have in their toolbox. This lady only had 1 tool and she just kept using it. I got a million tools. I'll have you put on orange glasses. I think putting on orange glasses is going to help you. I'll have you breathe colors if I need to. And that's that person was just this much. So it's got to match too. There's certain patients that will tell you that we don't match, we don't get along. It's 1%. We just don't work. So then I'll have Karen treat them. I don't treat somebody for the sake of just treating them in a business model. That's unethical. I'll refer out. I'll refer to my friend Ken. I'll refer to an acupuncturist. I'll refer, if somebody's not getting better in the first 6 visits, even 3 for me, I'll change what I'm doing completely. I'll have them move more, move less, or what have you.
That person worn out my medical
Yeah, that's
insurance.
That's unfortunate. All right, we're good?
Any other questions?
Okay, what are your hours?
Mondays we're here from 9 to 8.
Mhm.
Tuesdays we're closed. Wednesdays 9 to 8. Thursdays 1 to 8. And then Fridays 9:30 to 7.
Okay.
Si yo, por ejemplo, quiero darme una sesión de terapia, ¿tiene que sacar una indicación de
¿Tú tienes seguro médico?
Yo tengo, sí.
¿Qué clase de seguro tienes?
United Health.
United Healthcare. No, eso puede venir directamente.
No necesito la prescripción.
No.
No necesitas referido.
No, bueno, con la gente con Medicare hay mucho, casi 85% de los seguros no necesita referido. Pero con los Medicare, si tienes Medicare primario, con eso sí necesitas seguro. Pero si estás en mucho dolor, quieres ver un terapista, tú puedes venir a nosotros. Pero cuando tú vengas para la evaluación, 14 días después de la evaluación, tienes que escoger un referido. No importa, puede ser de tu doctor primario, no importa de qué doctor. Puede ser de tu primario, ortopédico. Si tú le preguntas a él, tú me puedes referir a alguien. Si tú tienes problemas con la rodilla, te va a referir a un ortopédico. Tú sabes. Pero con muchos de los seguros no se necesita referido. Tú me llamas a mí, me dices qué clase de seguro tienes y yo te digo.
Y por ejemplo, yo estoy con United Healthcare, pero es...
Con sí, pero es como un Medicare entre las dos Entre las 2 semanas de la evaluación se tiene que conseguir.
Sí.
Sí.
Okay.
So I'm gonna go do my MRI, entonces when I get the results, I'm gonna bring,
That's great, like you
I'm gonna
said.
bring all the other ones, because I
Yeah.
keep copies of
Yeah,
everything.
the more I
So you
have,
can look at them.
the easier and more streamlined my
Okay.
treatment will be.
We also are doing 30-minute free, what is it, evaluation? Consultations. It's 30 minutes. He'll, assess you. He'll tell you, what you need, and
Put me down for next meeting.
So that, if the insurance doesn't jive and
I'll
the self-pay
check my
is much, I can
schedule.
at least,
We'll work it out.
for those 30 minutes, I can at least help you educate the heck out of you as much as I can.
Yeah.
In my evaluation. Not evaluation, I can't say that, it'd be a consultation.
Y una persona que no tenga seguro, ¿de cuánto?
Bueno, con eso trabajamos porque nosotros vemos pacientes que no tienen seguro y tienen que pagar por cada visita. So, nosotros tratamos de... Nosotros tratamos, sí, de acomodarle, sí, no cobrarte tanto, cobrarte algo que tú puedas, tú sabes, pagar.
Pero más o menos.
Bueno, la primera visita, dependiendo del problema, la primera visita que es la evaluación, él te trata y todo, son 175 pesos. Pero después de ahí, dependiendo de qué problema tú tienes, cuánto tiempo tienes que pasar con él, puede ser de 50 a 90, dependiendo. Pero trabajamos contigo, tú sabes. Nosotros tenemos muchos pacientes que no pueden pagar y nosotros tratamos de trabajar con ellos para que ellos puedan venir aquí.
Okay.